A new era of critical healthcare has dawned in the heart of the Volta region. The Keta Municipal Hospital has officially unveiled its newly established intensive care unit, a repurposed section of the Disease Control Center, handed over by the Ministry of Health and the Ghana Health Service. Now fully furnished with the state-of-the-art equipment, the facility meets the standards of any modern ICU, offering life-saving interventions to patients in dire needs. At the commissioning ceremony held on the hospital grounds, Medical Superintendent Dr. Kakari Bonso couldn't hide his satisfaction.
Today marks a significant landmark in our quest to expand access to specialized and life-saving care for the people that we serve, and I see the good people of Keta and the surrounding communities. This ICU is not just a facility, but it is a lifeline. It represents a renewed hope for critically ill patients and critical advancement in healthcare delivery in Southern Belt of the Volta region. As many of us are aware, ICU beds in the region have been extremely limited. Until now, only the whole teaching hospital have 5 functional ICU beds serving the entire Volta region. The establishment of this unit here in Keta Municipal Hospital signals a new beginning. One that brings life-saving care closer to our people in Keta, Angola, and surrounding communities.
Dr. Kakari also used the occasion to appeal to the Ghana Health Service, Ministry of Health, development partners and stakeholders to continue supporting the hospital's long-term vision of becoming a fully fledged secondary level referral facility in the Southern Volta.
As we open this unit, we also look to the future. The ICU marks our clear intent to evolve into a fully fledged secondary level referral facility for Southern Volta. But to fully realize this ambition, we need additional investment in human resources and equipment. We respectfully use this occasion to appeal to Ghana Health Service, regional and national levels, the Ministry of Health, development partners, and other stakeholders to support Keta Municipal Hospital with specialized staff, particularly specialized doctors, critical care nurses, general nurses, pharmacists, and biomedical scientists. Essential ICU equipment such as patient monitors, ventilators, infusion pumps, and defibrillators, and ongoing support for staff training and professional development. Other units that we need to support this ICU are dialysis unit, which we already have and is fully functioning. And I want to inform our regional director that we have done almost about 500 sections of renal dialysis in this hospital without casualties. We need endoscopy units, which actually I'm a specialist in endoscopy. I need the unit to start to support the ICU. We need CT scan and we need MRI. Specialists in training, we have Dr. Mera in training as a radiologist. So if we get these things, we can stand as a strong hospital. And I want to tell everybody that this is Keta Kolebu, and I'm looking at even extending Kolebu to Harvard University Hospital. That is the hospital we are comparing ourselves with. Even beyond Kolebu, we are looking at Harvard University Hospital. That is our ambition.
The Municipal Director of Health Services, Mr. Emmanuel Kona, added his voice calling on the Regional Director to post more staff to run the unit efficiently.
With the establishment of this critical care unit, intensive care unit, like Mohamed should have said, means we will be needing a lot of resources. I want to plead with my regional director, if he could grant us the opportunity of sending interested staff who will want to specialize in this area, even if they have just there for 1 year or 2 and are interested, so that they can be given steady leave with pay to go and specialize in those areas, to come and help us man the units.
He also appealed to Keta and Angola assemblies to support the National Ambulance Service with fuel, noting this will allow for seamless transportation of accident victims without upfront payment. In addition, he urged the District Health Insurance Scheme to consider the enrollment of more critically ill patients to eliminate financial barriers to healthcare.
I will also want to appeal to our NHIS manager here, and if you could relay the information above, that ICU care is very expensive. And we know one of the barriers to healthcare is finance. So most of our brothers and sisters who may need these services may not be able to afford certain things if they are not there. So it is important we get the unit well equipped at all times so that when they come, the resources will be there to effectively take care of them. We will also want to plead with the Honorable Chief Executives present here, both Keta and Amoloka. If you could help our ambulance service in Keta here, so that maybe with some fuel, so that they can transport emergency cases to the ICU free of charge. A lot of the time when there is an accident, they have to rely on motorbikes, taxis, and we know that these people may not be trained in handling certain emergency cases. And just by the way the patient is lifted into the taxi and brought here alone can result in permanent damages.
Impressed by the hospital's transformation, the Regional Director of Ghana Health Service, Dr. Emmanuel Achudodo, commended the management for their dedication and pledged his full support to help elevate the facility into one of the top referral centers in the region.
What did you say the name is? Keta Municipal. I will tell Director General that Keta Municipal is doing a marvelous thing and that he will need the support so that we can have requisite staff trained to man the facility. Because, you know, ICU provides a specialized care. We use it for life-saving intervention. So, as a regional health directorate, we have to do everything that we can to make sure that this facility provides the services that it been established to do.
Despite this progress, the hospital continues to call for additional support, especially advanced diagnostic equipment like CT scan and MRI units. With this ICU now in operation, Keta Municipal Hospital is not just saving lives, it is setting the pace for modern healthcare delivery in Southern Volta. To contact PepsinoTv, call 0244 712 403.